Welcome to the deep dive. Today, we're diving into something I think a lot of you have been curious about, the healthcare system in Karnataka, India.
Yeah.
We've got a really interesting mix of sources on this one, including excerpts from a healthcare podcast that focuses specifically on Karnataka.
It's a really fascinating case study. You know, Karnataka is kind of like a microcosm of the challenges and the opportunities that healthcare in India is facing as a whole.
A microcosm.
Yeah.
So let's zoom in then and get a feel for the landscape here.
Okay.
Our sources paint this picture of a system that's rapidly evolving, but also facing some deep-rooted issues.
Yeah.
Where should we even begin?
Well, I think you have to kind of grasp the structure first.
Okay.
Karnataka, like many other regions, has this three-tiered healthcare system, right?
Yeah.
Primary, secondary, and tertiary care.
Got it.
But what's fascinating here is how those tiers are geographically distributed.
And that creates a whole other set of complexities.
All right, so let's break that down a little bit.
Okay.
We've got primary care at the village level.
Yeah.
Then you've got district hospitals for secondary care. But when it comes to tertiary care, the highly specialized stuff, it seems like everything revolves around Bengaluru.
Exactly. Bengaluru is the powerhouse.
Yeah.
You know, it's got these world-class hospitals, medical colleges.
Yeah.
So this concentration of advanced care in one city has advantages, of course.
Right.
But it also creates this dependence that can be really problematic.
I see.
Especially for people living in rural areas.
That makes sense.
Yeah.
And this is where the role of the government comes in.
Right.
Right. They're trying to balance this concentration with initiatives to improve access and quality across the entire state.
Absolutely.
Yeah.
One of the most ambitious programs is this thing called Arogya Karnataka.
Okay.
And this aims to actually achieve universal health coverage.
Which is a massive undertaking.
Yeah.
They're essentially trying to make sure that everyone, especially economically disadvantaged, can get the treatment they need in public hospitals.
It's a bold goal.
Yeah.
I'm curious, though, how do they handle the funding for a program like that? And is it truly reaching...
That's the crucial question.
Those who need it most.
And frankly, one that our sources don't fully address.
Okay.
It highlights a broader point, though.
Yeah.
Even with good intentions.
Right.
The implementation of these grand schemes can get really messy.
Okay.
Yeah.
So it's not just Arogya Karnataka.
Right.
They've combined that with the national Ayushman Bharat scheme to create AB-ArK.
Yeah, AB-ArK.
This program provides cashless treatment up to a certain amount for families. Our sources mention surgeries, dialysis, cancer treatments, maternal care.
All covered.
All being covered.
Yeah.
So,
while that sounds fantastic on paper, you have to consider the potential strain on resources. What are the selection criteria?
Yeah.
Are there enough qualified healthcare professionals
to
handle this influx of patients?
It makes sense.
These are the kinds of questions policymakers grapple with.
It seems like there's this constant tension.
There is.
Between ambition and reality.
Yeah.
They've also rolled out the 108 emergency ambulance service.
Right.
Which is a lifeline, especially in rural areas.
Absolutely.
Plus, they're building new medical colleges outside of Bengaluru and upgrading district hospitals with modern equipment and telemedicine capabilities.
All of this points to a government that's actively trying to decentralize healthcare and improve access.
I see.
But you can't just throw money and technology at a problem and expect it to magically disappear.
Yeah.
There are systemic challenges that run much deeper.
Let's talk about those challenges. Even with all these initiatives, it seems like Karnataka's healthcare system is still facing some pretty significant hurdles.
One of the most glaring is the very thing we discussed earlier.
Yeah.
The over-reliance on Bengaluru for tertiary care.
Right.
Imagine you're a villager who needs specialized treatment.
Yeah.
You might have to travel for hours, maybe even days, to reach Bengaluru.
It's like this massive bottleneck in the system.
It is.
And then you can't forget the financial burden.
Oh, absolutely.
That travel places on families who are already struggling.
Right. It highlights this urgent need for more super specialty hospitals outside of Bengaluru.
Makes sense.
Particularly in underserved areas like North and Coastal Karnataka.
Right.
Our sources indicate this is a major point of concern.
And then there's the shortage of healthcare professionals.
Oh, yeah.
Particularly in rural areas.
Big time.
It's a global issue.
Yeah.
But it's particularly acute in a country like India.
It creates this vicious cycle.
Yeah.
Doctors and nurses are drawn to urban centers with better infrastructure.
Right.
Higher pay, more opportunity. This leaves rural areas underserved.
Yeah.
Further reinforcing the need for people to travel to cities for care.
It's like a puzzle where each piece
It
affects all the others.
Oh.
And we can't forget about the rising burden of non-communicable diseases either.
Right.
Things like diabetes, heart disease, even mental health issues.
This is where preventive care and awareness campaigns become absolutely crucial.
Okay.
It's not enough to just treat people when they're sick.
Right.
We need to focus on preventing these diseases in the first place.
I see.
And that requires a fundamental shift in mindset, both among the public and within the healthcare system itself.
So it sounds like Karnataka is trying to juggle a lot here.
They are.
Improving access, addressing these regional disparities, tackling this rising tide of chronic illnesses.
It's a tall order.
It's a tall order.
It is.
And it's made even more complex by the role of the private sector.
Right. We can't talk about healthcare in India
without
acknowledging the significant role played by private hospitals.
Right, because Karnataka is home to some of the most renowned private hospitals in the country.
Absolutely.
Narayana Health.
Manipal Hospitals.
Fortis,
Apollo.
They're
all there.
They're all there.
And they offer cutting-edge treatments.
Yes.
Attract top medical talent.
Right.
But they also come with higher costs.
So we have this interesting dynamic.
We do.
A public system striving for universal coverage and a private sector catering to those who can afford it.
And what's fascinating is that these two worlds are starting to intersect in ways that could reshape the future of healthcare in Karnataka.
Okay, I'm intrigued.
Yeah.
Let's dive into that in the next part of our deep dive.
Welcome back to our deep dive into Karnataka's healthcare system.
Before the break, we were talking about this really interesting intersection between the public and private healthcare sectors in Karnataka.
Yeah, it's a space where you see some really innovative approaches emerging, particularly when it comes to bridging those gaps and access and affordability that we talked about earlier.
You mentioned the term innovative before the break.
Yeah.
What specifically are they doing that stands out to you?
Well, one area that's particularly exciting is the rise of these public-private partnerships.
Okay, I'm curious about how these partnerships actually play out in practice. Can you give me an example?
Absolutely. Let's take the issue of specialized care.
Okay.
We know there's a huge concentration of tertiary care hospitals in Bengaluru.
Right.
Which makes it really tough for people in rural areas to access these services.
That was a key point from the first part of our deep dive, for sure.
Right. So to address this, the government is actually incentivizing private hospitals to set up branches in these Tier 2 and Tier 3 cities.
So they're essentially encouraging private investment to spread out specialized care.
Exactly.
And make it more accessible to everyone.
Precisely. They're offering things like tax breaks,
Okay.
subsidies, even streamlined approval processes.
Wow.
To make it more attractive for these private hospitals to expand their reach.
It's a win-win, right? Yeah. The private sector gets these new opportunities for growth.
Yeah.
And the public benefits from improved access to specialized care.
Exactly. And we're already seeing some positive results.
Oh.
Our sources highlight a number of cases where these partnerships have led to the establishment of super specialty hospitals.
Wow.
In areas that previously lacked such facilities.
That's encouraging, but what about the staffing of these hospitals?
Yeah.
I imagine it's still a challenge to attract qualified doctors and nurses to work outside of the major cities.
It is, but that's another area where these partnerships are playing a role.
Okay.
Some of these initiatives include provisions for training and development of healthcare professionals in these regions.
So it's not just about building the infrastructure, it's about building up the workforce as well.
Exactly, and they're exploring various incentives to attract these healthcare professionals to these areas.
What kind of incentives?
Higher salaries, housing allowances, even loan forgiveness programs.
Wow, it sounds like they're really trying to tackle this issue from multiple angles.
They are, and it's not just about specialized care either.
Okay.
These public-private partnerships are also making a difference in areas like preventive health care and community outreach.
Can you give me an example of that?
Sure. We talked about the rising burden of non-communicable diseases.
Yeah.
To address this, the government's collaborating with private hospitals to organize health camps and screening programs in rural areas.
So they're bringing health care directly to the people rather than waiting for them to come to the hospitals.
Exactly. These camps offer things like blood sugar testing,
Okay.
blood pressure checks, and even basic cancer screenings.
It's a proactive approach, and it's crucial for catching these conditions early when they're more treatable.
Exactly. And it's not just about screening either. These camps also provide education on healthy lifestyles, nutrition, and disease prevention.
So it's a holistic approach.
It is.
That combines early detection with community education and empowerment.
Precisely. And these partnerships are also playing a role in expanding access to essential medicines. And vaccines.
It sounds like they're really trying to cover all the bases.
They are. And they're doing it in a way that leverages the strengths of both the public and private sectors.
One of the other key themes we touched on earlier was the role of technology.
Yes.
In Karnataka's healthcare system.
That's a fascinating area, isn't it?
Yeah.
We see technology being integrated into healthcare in so many different ways.
We talked about telemedicine earlier, but I'm curious to explore other ways they're using technology to improve healthcare access and delivery.
Well, one area that's particularly promising is the use of mobile health clinics.
You mean clinics that are literally on wheels?
Exactly. These clinics are essentially mini hospitals on wheels, equipped with basic diagnostic tools, telemedicine capabilities, and even pharmacies.
So they can bring a wide range of healthcare services directly to these remote communities.
Exactly. And they're not just limited to rural areas either. These mobile clinics are also being deployed in urban slums and other underserved communities.
It's an incredibly versatile approach.
It is. And it's proving to be very effective in reaching populations that might otherwise have limited access to care.
What about the use of data and analytics in healthcare? Are they doing anything interesting in that area?
They are. Karnataka is actually at the forefront of using data to improve healthcare outcomes.
How so?
They've developed a comprehensive health management information system that tracks everything from disease prevalence to hospital bed occupancy rates.
So they're collecting a vast amount of data, but what are they doing with it?
They're using it to inform policy decisions, identify areas where resources are needed most, and even predict and respond to disease outbreaks.
So it sounds like they're using data to make the system more efficient and responsive.
Exactly. And they're also exploring the use of artificial intelligence and machine learning to improve diagnostics, personalize treatments, and even predict health risks.
So we're seeing technology being applied across the entire spectrum of healthcare. From prevention to treatment and even policymaking.
Precisely. And it's all part of this larger effort to create a more equitable, accessible, and effective healthcare system in Karnataka.
And this brings us back to one of the other key challenges we discussed earlier, affordability.
Right. Even with all these innovations, the cost of healthcare remains a major barrier for many people in Karnataka.
Especially for those who rely on the private sector for specialized care.
Exactly. And that's why expanding health insurance coverage is such a crucial piece of the puzzle.
We touched on this in the first part of our deep dive. But I'd love to delve a bit deeper into the different approaches they're taking to address this challenge.
Well, one approach is to expand the reach of these government-sponsored health insurance schemes. Like AIinHealthcare Karnataka.
We talked about AIinHealthcare Karnataka earlier. It aims to provide free or subsidized health care to those who can't afford it.
Right. And the government's constantly working to expand the scope of this scheme, covering more people and a wider range of treatments.
But even with government schemes, there are limitations, right?
There are, and that's where private health insurance comes in. The government's also encouraging people to buy private health insurance by offering things like tax incentives and subsidies.
So it's a two-pronged approach, expanding government schemes, while also incentivizing private insurance adoption.
Exactly. And they're also exploring other innovative financing models.
Like what?
Such as community-based health insurance schemes.
What are those?
They're essentially small, localized insurance pools. Where members contribute a small amount each month to cover healthcare costs within the community.
It sounds like a microinsurance model.
It is. And it's proving to be particularly effective in rural areas. Where access to formal insurance is limited.
So they're experimenting with different approaches to find what works best in different contexts.
They are. And they're constantly learning and adapting as they go.
It's a dynamic process, for sure.
It is. And it's one that I think will ultimately lead to a more affordable and accessible healthcare system for everyone in Karnataka.
I hope so. And it's not just about affordability either. It's about ensuring that everyone has access to quality health care. Regardless of their location or socioeconomic status.
Absolutely. And that brings us back to the issue of these regional disparities.
Right. We talked about the need for more super specialty hospitals outside of Bengaluru.
Exactly. And while those public-private partnerships are helping to address this, there's still a lot of work to be done.
What are some of the other challenges they're facing in this area?
One of the biggest challenges is the lack of infrastructure in many rural areas.
I imagine things like roads, electricity, internet connectivity are essential for supporting modern healthcare facilities.
They are, and these are often lacking in these remote areas.
Right.
So even if you build a hospital,
yeah,
it's tough to staff it and keep it running.
Right.
If the basic infrastructure isn't there.
It's like a chain, right?
It is.
Each link needs to be strong for the whole thing to work.
Exactly. And they're also facing challenges in terms of cultural attitudes towards healthcare in some rural communities.
What do you mean by that?
Well, in some communities, there's a strong reliance on traditional medicine. And a reluctance to seek modern medical care.
So it's not just about building hospitals and providing access.
Yeah.
It's also about addressing these cultural barriers.
Precisely. And that requires a sensitive and culturally appropriate approach.
It sounds like a complex undertaking.
It is. Yeah. But it's one that the government is committed to addressing. They're working with community leaders and healthcare providers to build trust and raise awareness about the benefits of modern medicine.
It's an ongoing process.
It is, and it's one that requires patience, understanding, and a willingness to listen to the needs of these local communities.
So we've covered a lot of ground in this part of our deep dive.
We have.
We've talked about public-private partnerships, the role of technology, the challenges of affordability, and these ongoing efforts to address regional disparities.
It's a multifaceted issue for sure.
It is, but it's also a fascinating case study in how a state is trying to innovate and adapt to meet the healthcare needs of its diverse population.
Exactly, and it's one that I think holds valuable lessons for other healthcare systems around the world.
I agree. So before we wrap up our deep dive into Karnataka's healthcare system, I want to touch on one more important topic, mental health.
Yeah, it's an area that's often overlooked.
It is.
But absolutely crucial to overall well-being.
Absolutely. And from what our sources indicate, it's an area where Karnataka faces significant challenges.
That's right. The mental health infrastructure in the state is still inadequate.
Okay.
Particularly in rural areas.
So access to mental health care is a major issue.
It is. There's a severe shortage of mental health professionals. Especially psychiatrists and psychologists outside of major cities.
And I imagine there are also cultural stigmas surrounding mental health that prevent people from seeking help.
That's a major factor as well. Mental illness is often seen as a weakness. Or something to be ashamed of, which makes people reluctant to talk about it or seek treatment.
So it's a combination of lack of access and these societal barriers that are preventing people from getting the care they need.
Unfortunately, yes. But the good news is that the government is starting to recognize the importance of mental health and is taking steps to address these challenges.
What kind of steps are they taking?
Well, one of the key initiatives is to increase funding for mental health services.
So putting more resources into training mental health professionals and expanding access to care.
Exactly. They're also working to integrate mental health services into primary healthcare settings.
So making it easier for people to access mental health care in their own communities?
Precisely. And they're also launching awareness campaigns to reduce the stigma surrounding mental illness.
It's encouraging to see that they're taking a multi-pronged approach to addressing this issue.
It is. And it's a recognition that mental health is just as important as physical health. And that everyone deserves access to quality care.
Absolutely. So as we approach the end of our deep dive, I'm struck by the sheer complexity of Karnataka's healthcare system.
It's a system that's constantly evolving.
Yeah.
Facing challenges, but also embracing innovation and striving to improve.
And it's clear that there's no easy fix.
No.
It's a long-term process that requires ongoing investment, collaboration, and a willingness to adapt.
Exactly. But despite the challenges, there's a sense of optimism, a belief that things are moving in the right direction.
I agree. And it's clear that Karnataka is committed to building a healthcare system that's equitable, accessible, and responsive to the needs of its diverse population.
It's a goal worth striving for.
Absolutely. So in the final part of our deep dive, we'll reflect on what we've learned and explore what the future might hold for Karnataka's healthcare system. Welcome back to the deep dive. We've spent this whole episode kind of exploring the healthcare system in Karnataka.
Yeah.
And it's been quite a journey, I think.
It has been. It's been really interesting.
Yeah, we've seen these intricate layers of the system.
Right.
From, those village clinics all the way to those advanced hospitals in Bengaluru.
Yeah, and the challenges and the innovations and this sheer determination to try and create a healthcare system that works for everybody.
Yeah, and it's a complex picture for sure.
It is.
But I think that's what makes it so compelling.
It does.
Right, it's not like a simple narrative.
Yeah.
This is a story that's still being written.
Absolutely. And it's a story that, you as someone who's interested in global health systems can really learn from.
Yeah.
You think about the parallels to other rapidly developing regions.
Yeah.
The struggles to balance urban and rural needs.
Yeah.
The rising costs of care.
Yeah.
The integration of new technologies.
All happening.
These aren't just issues for Karnataka.
Right.
These are global issues.
Yeah.
But what we see in Karnataka is this incredible willingness to experiment, to try new approaches, and to learn from both the successes and the failures.
Well, one thing that really struck me throughout our deep dive was this emphasis on public-private partnerships.
Yeah.
It's not just the government acting alone.
Right.
It's this collaboration between public and private sectors that seems to be driving a lot of the innovation.
Those partnerships are really interesting.
They are.
You think about it, the incentives for private hospitals to set up branches in these smaller cities, the joint efforts to organize these health camps in rural areas, the combined push for telemedicine adoption.
It's really interesting.
It's a recognition that neither sector can solve these complex problems alone.
And it's not just about throwing money at the problem.
No.
It's about strategic collaboration.
Yeah.
Leveraging the strengths of each sector to create a more holistic and sustainable healthcare system.
What's fascinating is how that approach is being applied across the board.
Right.
To address these regional disparities.
Yeah.
To improve affordability. To integrate technology. Even to try and tackle these deeply ingrained cultural barriers to healthcare.
And let's not forget the role of technology.
Yeah, technology is huge.
We've talked about telemedicine connecting rural patients with specialists in those big cities.
Right.
Mobile clinics bringing healthcare to these remote communities, and the use of data analytics to improve decision-making.
It's clear that technology is playing a transformative role.
It is.
In shaping the future of healthcare in Karnataka.
But it's not just about, adopting the latest gadgets.
No, it's not.
It's about using technology in a way that's appropriate for the local context, that's culturally sensitive, and that truly addresses the needs of the people.
That's a crucial point.
It is.
Technology can be this powerful tool for good.
Right.
But it needs to be implemented thoughtfully.
Yeah.
With a deep understanding of the local context.
And otherwise you run the risk of exacerbating existing inequalities rather than bridging them.
Exactly. And that's why it's so important to have those community-level perspectives involved in the design and implementation of these technological solutions.
So where do we go from here?
Yeah.
What are the key takeaways from our deep dive into Karnataka's healthcare system?
Well, I think one of the most important takeaways is this power of innovation.
Yeah.
Karnataka is not afraid to experiment, to try new things and to learn from its mistakes.
Right.
That spirit of innovation is so crucial in a world where healthcare systems are constantly evolving.
And this innovation isn't happening in a vacuum.
Right.
It's driven by this deep commitment to equity, to ensuring that everyone has access to quality healthcare, regardless of background or location.
That commitment to equity is truly inspiring.
It is.
And it's reflected in everything, from the design of government programs to the strategic partnerships that they're forging.
Another key takeaway, I think, is this importance of collaboration.
Oh, absolutely.
We've seen how those public-private partnerships are driving progress, how technology is being integrated into the system, and how community engagement is shaping healthcare delivery at that grassroots level.
Right. It's a reminder that these complex problems require collaborative solutions.
And these collaborations need to extend beyond Karnataka's borders.
Yeah, they do.
The challenges facing Karnataka are not unique. They're shared by healthcare systems around the world.
All over the place.
So there's so much we can learn from each other.
Absolutely.
From sharing best practices to collaborating on research and innovation.
It's about seeing Karnataka not just as a case study, but as a source of inspiration.
I like that.
A model for how we can approach these healthcare challenges.
Yeah.
With creativity, with determination, and a deep commitment to leaving no one behind.
I think what I find so hopeful is that Karnataka's healthcare story is still unfolding.
It is.
The progress they've made is remarkable.
It is.
But they're not stopping there.
Yep.
They're constantly pushing the boundaries, seeking new solutions, striving to create a healthier future for all.
It's a story that deserves to be told.
It does.
Shared and learned from.
And as someone who's, deeply engaged with this topic, I encourage you to dig deeper, explore those aspects of Karnataka's approach that resonate most with you, and to consider how these lessons might be applied in your own work or within your own communities.
That's a great challenge to leave our listeners with.
It is.
The future of healthcare is being shaped right now.
Yeah.
And we all have a role to play in making it a healthier future for everyone.
Thank you for joining us on this deep dive.
Yeah, this was a good one.
We'll be back soon with another fascinating exploration.
We will.
And until then, keep learning.
Yeah.
Keep asking questions.
Keep diving deep.
And keep diving deep.